Coronavirus fears continue to climb. I'm Marco Perry. Welcome to the Perry Platform. You can begin to see that the narrative surrounding coronavirus is changing, especially in Canada. A couple weeks ago, health officials were telling us that it's not really that big of a deal, it's comparable to the flu, you've nothing to worry about, you'll be fine. But now, the tune has changed into Canada considering something along the lines of possible pandemic responses to the coronavirus. It's a big change. I don't think anyone would consider the common flu to be pandemic worthy, but the coronavirus obviously is. So, the CBC reports that Canada is preparing to respond to a possible pandemic as the number of coronavirus cases continues to climb around the globe. Theresa Tam, our Chief Public Health Officer, says the virus is evolving fast, and that's been my worst fear from the start. When the virus starts to change and we can't predict how it's going to move, that's when we get caught off guard. Right now, it's mostly contained in China, but the virus is spreading at the community level, person to person, in several other countries now. There's a way to measure what she's talking about, and that's called the transmission rate. It tries to estimate how, once someone is infected, on average, how many other people can they realistically spread the virus to. In the case of this novel coronavirus, the transmission rate is 2 to 3 people. So, from 1 patient, it can turn to 4. You add 3 to the 1, and from 4, you can turn it to 16. Each of those 4 infects 3 more than you add the original 4, and so on. It's an exponential growth curve. The most troubling aspect, though, of these developments is that containing the virus right now seems to be unlikely. The job, bluntly put, has been botched. It would be one thing if China locked down the Hubei district and cases around the world weren't popping up, but it's the exact opposite. So the district is locked down, but more and more cases are showing up in random places around the globe right now. If we were able to properly quarantine the disease, that would have been a very helpful tool. It would have allowed us to effectively play the waiting game, to minimize the amount of damage that is going to be done via it causing people to die and whatnot, but instead, we have to play catch up now. We don't even know where it's going to hit next. It's one step ahead of us. We also have to deal with the realities of hosts just becoming a plentiful thing for the virus in a variety of places. It only takes one person to trigger a chain reaction of infections. One patient zero can cause a disaster in any country. And right now, we don't know who these patients are, where they've been, and where they're going. Somehow, someway, countries didn't act swift enough and people were permitted back inside while they were sick. I do think that China has done an admirable job at handling things on their end, but in terms of the other world governments, they needed to shut down flights immediately, and they had to screen returning travelers with a more serious tone, with the possibility of quarantining them at the slightest indication of them being infected, but that did not happen, especially in Canada. If you remember, the first case was because the guy who had the virus told airport staff that he felt sick, but he was allowed to leave. He was allowed to enter the populace, and we're so lucky that didn't balloon into a bigger disaster. Now, Theresa Tam goes on to state that the trajectory of the coronavirus is currently unknown. It's possible that even more cases have occurred, but they've yet to be documented, and this sounds to me as if she's just saying that somewhat we're blind right now. We don't know what the full scope is, and unfortunately it's being complicated by us not even knowing how many actual cases there are. If we go back to the idea of restricting travel, this complicates the matter because now it's not only an issue of stopping flights to and from China. A multitude of countries around the world have the virus, and maybe even more that we don't know about yet. What are we going to do? Stop travel from everywhere? It takes one patient to infect a community. That person can come now, not just from China, but Italy, from Iran, South Korea. The list is getting bigger and bigger day by day. And since countrywide containment is quickly looking like a failure, the next best option here is to limit community exposure. For the individual to take steps such as what they would do during a typical flu season. So wash your hands, don't touch your face, stay home if you're sick. And that's only the next best step because at the governmental level, they didn't really do their job to the best of their ability. This is a stalling game now until we either develop a vaccine for the virus or the virus subsides. or the third possibility, we get wiped out, which is very unlikely. I'm just joking about that. And now, Health Minister Patty Hajdu chimed in and said that if the World Health Organization declared this a pandemic, which they haven't done yet, it would render travel restrictions meaningless because it would mean that efforts to contain the virus have failed. Now, they are half right and half wrong about what they just said there. First of all, efforts to contain the virus have failed. That is true. I think there's a lot of evidence to point towards that. And right now, it seems like curbing it isn't going to happen. We're going to have to ride the wave a little bit. But where they are entirely wrong is in saying that travel restrictions would be basically meaningless if they declared a pandemic right now. Travel restrictions would definitely not be meaningless. If you open the floodgates, you can definitely make things a lot worse. If you truly think that travel restrictions don't matter, well, every country should just open the gates to everyone in Wuhan right now and let them come through. Because a big problem in that community is that hospitals are being overstaffed. The people there want to be treated, but they can't get it. So, let them come to Canada then. Let them go to the States. Let them do all of this. The answer to this line of inquiry, though, is that would have catastrophic outcomes. Because once you're on the plane, people on the plane can be infected. Screening methods have proven to be not the best during this period of time. And at the same time, all you're doing is increasing the likelihood of the virus spreading. Travel bans aren't the best thing. They're not highly effective, but they do something. They are limiting the scope of our exposure by some degree. To say that it would be ineffective if the World Health Organization declared a pandemic, I'm not really buying into that line of logic. But despite that, it's a common consensus right now that we aren't really at pandemic territory per se. For something to become a pandemic, it's typically evaluated based on three criteria: geographical spread, severity of disease, and impact on society. First of all, the geographical spread is certainly there. In a lot of countries, the coronavirus has become a thing, but where they are giving it some room to not call it a pandemic lies in the severity of the disease and the impact on society. So, right now it's sitting at around a 3% mortality rate. People who are dying are typically the elderly or the very young, and the death figures haven't been extremely mind-boggling. At the same time, many societies where the virus has spread to are not being adversely impacted. There's a handful of deaths that have occurred, and sub 500 cases in most countries. Obviously, some places are worse than others, but overall, large-scale deaths across the world haven't been witnessed outside of China. So, what do we do now? Tam says that they are trying to take enforced border control measures. At the same time, she said that international travelers to Canada will be told to self-isolate if they are experiencing flu-like symptoms. Good luck with that. Self-isolation is a failure of a plan. Now, before I tell you why, I must say I do understand that resources are limited, and sometimes that's the only answer you have. We can't be watching everyone. Telling people to take care of themselves makes sense in that regard. But if someone is feeling sick, you're really going to leave it up to them, to their non-medical discretion, to go about their day? To really trust them to isolate themselves and not spread the coronavirus? To me, it's a pretty serious condition, and we should be finding ways to allocate resources to make sure people don't have to figure out the answer for themselves. The real solution is to test people at the airport, and if they do display symptoms, then, or even later, they can call you and you quarantine them on their behalf. Self-isolation is a risky game. People generally aren't that reliable, and we're playing with the potential spread of the coronavirus. To me, it's not the most wise policy. But now, let's look at some of the numbers. So, Worldometer.com places the amount of total coronavirus cases right now at over 80,000. The estimated death toll is over 2,700. Based on these figures, we can deduce a fatality rate of 3.3%. Now, that is relatively troublesome. It seems to be more dangerous to those who are immune compromised, like the elderly. But there may be some silver lining here. As pointed out in the article, it's likely that more cases exist that we don't even know about, cases that are not being documented. And coupling that with another fact is that it's harder to have undocumented deaths though. If someone dies, well, we're going to find out the reason for that. If you get the illness but you recover, we may never know. If someone develops a milder reaction to the coronavirus and doesn't report it, they'll simply carry on with their life. But if someone dies because of it, through an autopsy, we're sure to reveal the cause. Based on that, we can actually assume that the cases would be higher in total, but the deaths would remain similar. That would dilute the fatality rate and bring it down, because the denominator would grow. There would be supposedly more cases, but the same amount of deaths. Maybe that rate falls to 2.5–2%. But regardless, it's still a bunch of people who are dying in terms of raw numbers and a bunch of people who are getting affected. At the same time, we are relying on governments like China to provide much of these statistics, so take that how you will. Authoritarian regimes typically like to avoid causing public panic, and one way to do that is to downplay these numbers. If I had to bet, I would say that there has been some funny business going on in the background, but I can't prove it, and China knows I can't, so right now it's all just hearsay. But outside of China, South Korea has been hit pretty hard as well. They have the second most cases at near 1,000. They've also experienced 11 deaths as a result. If you look at the numbers there, the fatality rate is actually pretty low, closer to 1%. That may be due to their hospital facilities being able to care for people, having the capacity, but whatever they're doing, they found a way to minimize the amount of fatalities, and that's a good thing. Even given the fact that they have a bunch of cases to take care of. And outside of Asia, Italy has also been affected adversely as of late. They are nearing 300 cases with 7 deaths. Italy is a tragic story, really, because they botched their strategy. There was a lot of incompetence going on at the governmental level. They could not identify patient 0. They thought they knew who it was, but they were wrong. And that person, the actual patient 0, was basically let loose into the country, and they were free to spread the coronavirus at their whims. At that point, containing it was near impossible because they had no idea who was spreading it. They didn't know where it was coming from, and they couldn't accurately track down what areas had to be shut down. As a result, much of northern Italy is just being quarantined right now. Festivals are being shut down, people are being told to stay home, I believe school is cancelled, a lot of conundrum going on. Containing it is pretty much impossible given that lack of information. And Italy did try to do something here, but it failed. They tried to cancel direct flights from China into Italy, but given the EU structure, it was never going to work out. People can just fly to another part of the country where these flights are not banned, and from there, they can enter Italy. The same can happen for Canada, actually. Someone can just fly from China to Japan, and from Japan to Toronto. This is possible. Simply banning a direct flight isn't going to do anything when the world is not united in their effort to lock down the virus. The rest of the EU looked at Italy, and they said, guys, this idea sucks. There's so many holes to it, but you still think it's going to work? And obviously it did not. In the European Union, it needed to be a united front. Every country there had to have the same rules, and they had to think it through. They did not do that, so there was lots of opportunity for people to just find their way in. And another country that is having issues right now is Iran. 15 people have died, and here's the craziest part of the story. Their own deputy health minister says that he's contracted the virus. He was doing a press conference and he looked under the weather. I believe he was sweating, giving off signs that he wasn't well. And then at the same time, he was saying, oh, there's no need for a quarantine. It's whatever. So the perfect level of irony. And then a couple of days later, he's like, yeah, I have the virus. I'm about to go self-quarantine myself. So yeah, it's a big issue. Canada, on the other hand, has done fairly well thus far. No deaths have occurred. Now, to make sure things start trending in the proper direction, I'd suggest the world be on the same page about this containment effort. Are you going to keep trying to do it, or are you not? You can't have some countries trying to contain it and others not caring, because there's so many loopholes here, as we've seen with Italy, and it can affect Canada too. If we're going to shut down travel from one place to another, it has to be for every country. People from China can just circumvent the system if you allow some places to accept them and others do not. I don't know what the right answer is, but we need to be on the same page about it. Where should people be able to fly, and where shouldn't they? Do we care about quarantining and isolating, or do we not? Then after that's figured out, the next step in our progression process is to figure out how we can get a working vaccine accelerated. If it's funding, we need to provide that. If it's getting more scientists together and giving them time to work on it, we have to do that. That seems to be one of the things that we can cling to for hope. Quarantining and whatnot has been a massive failure, and more people, day by day, are getting affected. Having a vaccine would stifle the spread rather rapidly and it will give countries with a more susceptible system a fast answer to solving the problem without having to bog down their healthcare system if it's not able to keep up. And hopefully, the warm weather that's coming around the corner is going to help curb the spread. But things can go either way right now. If more and more countries botch their operations like Italy, it's not going to be good for neighboring countries, and that's going to spread and it's going to be a snowball effect. But if we get our things together, if we start to act as a global unit, I have no doubt that we can contain this and we can find the answer rather swiftly. It comes down to the level of cooperation that we are willing to put forward and how realistic we can be with our goals here. Unfortunately, right now, I can't help but shake the feeling that world governments are just disorganized and confused. We don't have a clear view as to what's going on, and we don't have a vision on how to correct that. We're stumbling through the dark right now, taking it as it comes. We have to plan ahead and really create a strategy right now to make sure that things don't get far worse. So, that now brings me to the end of our conversation for today. If you enjoyed the content, be sure to leave a review and share. They'll help us grow. And you can find me on Twitter and Instagram at Perry Platform. Thanks for joining me, and I'll see you soon.